Here we're going to go through a normal search pattern on a normal chest x-ray. First we'll take a quick gross look at the entire chest, make sure there's no asymmetry. Then we'll start here at the right upper quadrant and we're going to work our way across the midline looking underneath the diaphragms. We're looking for air or fluid. Here we see the normal gastric bubble. Coming back we see the liver here overlying this region, and it is pushing the right hemidiaphragm a little higher than the left. Then we're going to go up the thorax and we're going to look at horizontal sweeps throughout the thorax. We're looking at ribs as we go up. We're looking at the soft tissues. We can see breast shadows here. And we keep going up. We'll look at the shoulder girdle and the clavicle. We'll cross to the other side, and then we'll go down looking for rib fractures, the shoulder girdle, and soft tissues coming down. Now we'll go and look through the mediastinum. First we're going to take a general look and make sure there's no widening to suggest aortic injury. Then we're going to look at the tracheal air column, and we can see it here coming down in the midline. Here we can see the carina, and we can see the right mainstem bronchus and the left mainstem bronchus. Next we're going to come back down and look at the aorta and the heart. So first we'll see the aorta. We see the aortic knob here, and we can see the aortic shadow coming down here. Then we see the pulmonary artery hump, and then looking at the heart border we can also see a left atrial hump if it's enlarged. And then here you see the left heart border, which is made up of the left ventricle. Then looking at the other side, you can see a little bit of the right heart border, which is made up of the right atrium. The right ventricle is anterior. Now we'll also look at the size of the heart, so we'll look at the cardiothoracic ratio. And basically you want to make sure that when you compare the size of these two diameters, that it's less than 50%. Next we're going to go ahead and look at the hilum. So you take a horizontal view here and look at the hilar vessels, and the left hilum is usually slightly higher than the right. Now we're ready to look at the lung fields. We're going to start one lung at a time and then look at both together. So first we just we start at the costophrenic angle in the right lung base, and then we're going to go horizontally back and forth, and we're looking for pulmonary nodules, which we would see in the periphery. We're looking for pulmonary vascular congestion, which we would see as dilated pulmonary vasculature. We're looking for pneumothorax, which would look like loss of lung markings, and you would see a pleural line. We're also looking for any airspace opacities, which may represent atelectasis or pneumonia. And then of course you're looking for a pleural fusion in the costophrenic angles. Again, we're going to do the same thing on the left lung. We're coming down, looking at the same things. And then another important area that you always want to check for is the retrocardiac area. Here you want to be able to see some lung markings behind the heart. Make sure there's not increased density in this area. And then we can take a quick look at both lung fields at the same time, make sure everything is symmetric and nothing is popping out. And basically that would complete the search pattern of a normal chest x-ray. You want to make sure you also look at a lateral if it's available, and make sure you check with a prior if that is available.